This broadcast is brought to you by the Phillips Learning Center. The full e-learning course on stroke, treatments, clinical trials, and imaging technologies can be found at theonlinelearningcenter.com under the Diseases and Conditions section of the course catalog. This course reviews stroke, types of stroke, symptoms and risk factors of stroke, various drug therapies, and ongoing research details, and various imaging modalities. Stroke is the leading cause of neurological damage and adult disability. It is the third leading cause of death in the United States. Compared with Caucasians, young African Americans have a 2 to 3 times greater risk of ischemic stroke, and African American men and women are more likely to die of stroke. A stroke occurs when there is a blockage of blood flow or bleeding in the brain. There are 2 major types of stroke: ischemic and hemorrhagic. Ischemic stroke occurs due to the blockage of a blood vessel supplying the brain. Ischemic stroke is the most common type of stroke, with 80% of all strokes falling under this category. Hemorrhagic stroke occurs when a plaque-encrusted artery breaks and bleeds within the brain or in the coverings of the brain. Hemorrhagic stroke accounts for 20% of all strokes. A transient ischemic attack, known as TIA, is a mini-stroke which gets resolved in a short duration and results in no noticeable symptoms. Symptoms of a stroke may appear suddenly, including sudden numbness or weakness of an arm, leg, face, especially on one side of the body, sudden confusion, trouble in speaking or understanding, vision problems in one or both eyes, difficulty in walking, loss of balance or coordination, dizziness, and severe headache with no known cause. If you think someone is having a stroke, act fast and do this simple test from the National Stroke Association. There are a number of unmodifiable risk factors for a stroke, such as age, gender, race, and family history. Other risk factors include hypertension, diabetes mellitus, cigarette smoking, transient ischemic attack, carotid and peripheral artery disease, excessive alcohol intake, obesity, and high cholesterol. The most common treatment for stroke is drug therapy and medication. The most popular drugs to help prevent or treat a stroke are antithrombotics and thrombolytics. The National Institute of Neurological Disorders and Stroke Progress Review Group has identified 5 overall priorities for research and science. To determine the cause of the stroke, physicians use a number of diagnostic techniques and imaging methods. Some of the commonly used imaging modalities include computed tomography, or CT, magnetic resonance imaging, or MRI, arteriography, ultrasound, and positron emission tomography, or PET.